in a broader context, and I think that's where we have to get more sensible about it.
Yeah. Mixing it up a little bit. Recently, I mean, Angelina Jolie, in a way, became sort of an unexpected poster girl for the field of personalized medicine. And my question to you is, so if I'm the reporter calling you on deadline for the bigger picture, what takeaway to my audience of, healthcare consumers do you want them to take? What's the lesson of the Angelina Jolie story as it relates to personalized medicine? Catherine?
Well, I'll say what I said backstage, which is, where are her ovaries? Was my first comment, because we know that these genetic mutations put people at risk for ovarian cancer, which is very difficult to detect and very deadly for many people with this condition. But I think that in general, I think Angelina Jolie I look at it as a positive for personalized medicine, because I think it has brought awareness to the role that genetics plays in terms of risk, and that you can be proactive when I say patient, I should clarify, patients, I refer to everybody as a patient, because I feel that we're all patients, whether we're in our well state or our ill state. So I think that she's a good example of a patient who has really taken her health into her hands. She has some control over her destiny, and I think she's really been a good influence, I think, on personalized medicine.
Have you seen those kind of conversations filtering into the clinic setting?
Definitely. So I've actually had a number of people, call me up and say, "Oh, I had this relative, that relative with breast cancer. Do I need to get this genetic testing?" And so I think it has brought to light the need to educate our clinicians who may not be as well informed in genetic risk, so they can help identify people who really are at risk and who need genetic testing, because a lot of risk can just be really determined based on family history and does not require expensive testing. And I think it also brings up the need for geneticists, medical geneticists and genetic counselors who can really help us to screen these people, triage them, and make sure that they get the appropriate testing or screening that they need. So that's been very important.
Before we move on, I mean, the genetic counselor idea, can you unpack that a